Hey guys, I'm Dr. William Summers, and I want to thank you for watching video 4 in my series, Weight Management, A Class with ACT. It may seem like mild weather, but a storm is coming. I just discussed how insulin is necessary for us to be fed and necessary to store fat under our skin, which we'll use later as fuel between meals. And I hope you understand we want our fat-making insulin to remain in the proper low-level range when we eat, so we get fed now and store necessary fat fuel we will need between meals. And I hope I helped you understand that when we have higher insulin blood levels from the abundance of simple, man-made sugars we keep in foods today, then we store too much fat. We eat foods we assumed are okay, and we move from a normal weight to a little extra weight. This may start with just a little extra pinch in your belly, which initially is not too upsetting. So you get a little extra fuel to use between meals, and insulin is in charge of this extra fuel. At that point, what happens to your insulin when you have this extra fuel? Spoiler alert, it goes up. And about this time, when you say a bit extra, no big deal, it is about to worsen. Because when you have this little extra fat storage, a situation is created. Your insulin will go up. You will start making more. At this point, even with God's sugars, you get a little extra insulin and fat. Moreover, man-made sugars, creating sugar bombs, will result in even greater insulin spikes. And anytime you eat, you will start storing more fat. We have to eat. And when you do, it will make your insulin go up again, and this will cause more belly fat. And here we go, autopilot. This walking up the stairs, more belly fat, more insulin, more belly fat, more insulin, is called insulin resistance. Go up the first few steps, and this is referred to as mild insulin resistance. A few more steps, moderate insulin resistance, until we get higher up the hill to severe. The doctory word for type 2 diabetes is severe insulin resistance. So we have two diseases from this insulin excess, obesity and type 2 diabetes. And just to clarify, people who have type 1 diabetes are folks who make no insulin. The incidence is unchanged since the beginning of time. People with type 2 diabetes are folks who make too much insulin, and the incidence is growing off the chain. We all started stepping up this hill gradually after World War II. And by 1970, we seemed to be riding escalators to go up this hill. In 1964, type 2 diabetes was diagnosed when a hemoglobin A1C was 5.9. 1 in 200 people had gotten up that high on the insulin-resistant hill, 0.5% of the population. And let me clarify that A1C is not an insulin level, but instead a marker of how high your blood sugars reach over 3 months previously. Red cells live 9 to 120 days. High levels of blood sugar literally sugarcoat our red blood cells. Normal blood sugars don't. As we step up the insulin hill, more belly fat, more insulin, our blood sugars get higher and our A1C goes up because our red cells get more sugar stuck on them. So in 1964, a significant population increase in A1C was noted, and it was determined that an A1C of 5.9 meant you were high enough on the hill to be diagnosed with type 2 diabetes. But we all kept stepping up the hill with widespread man-made sugars and corn syrup and the addition of high-density fructose corn syrup. When I became a doctor in 1985, the A1C to diagnose a patient with type 2 diabetes was moved from 5.9 to 6.1. Years later, it was moved to 6.5, where it remains today. And this is all about to change since the new recommendations are to move it to 7. Moving the A1C up to make the diagnosis of type 2 diabetes makes it look like type 2 diabetes incidence isn't growing. Be aware, if we use an A1C of 5.9, high enough in 1964 to be bad enough, 50% of our population today, not 0.5%, would be diagnosed as type 2. An A1C of 5.9 to 6.4 is prediabetes, which is oddly convenient for third-party payers to not pay for appropriate medicines unless a 6.5, soon to be 7, is reached. Let's just let this disease get worse before we do something about it. Sort of their way of saying, take an aspirin and call me in the morning. In an upcoming video, I'm going to inform you how this rise in insulin and rise in the fat storage affects 4 other chemicals in our body. And these 4 chemicals will begin to join in and produce even more weight gain when you eat. When normal stuff gets messed up, we call that a disease. And this messed up stuff I describe is exactly the disease of obesity. Spoiler alert, the 4 chemicals are targeted in new medicines for obesity, and I will discuss these later. In simple summary, we easily become overweight and stuff changes, which makes us even more overweight. This is a good time for me to talk about PCOS. I mentioned earlier that I am boarded in OBGYN as well as obesity, so I am staying in my lane. One sugar, one insulin is normal. In our culture, and with what is packaged for us to eat, we become overweight. So we go from one sugar and one insulin to one sugar with two insulins. And we get more belly fat, and then 3 insulins, resulting in more belly fat. We can all keep walking up these steps from normal to mild insulin resistance to moderate to severe, which is type 2 diabetes. Let me change gears and discuss the normal thermostat-like function between the brain and ovary. The back of the brain, hypothalamus, signals the front of the brain, pituitary gland, to signal the ovary to make hormones. The ovary responds, and 1 to 4 bubbles called follicular cysts appear inside the ovary. And these small cysts make estrogen for 2 weeks. And estrogen will make the lining inside the uterus grow taller. And then only one of these small follicles will grow and the others will recede. When the remaining follicle reaches a large enough size, it will rupture, releasing the egg, ovulation. Now, after ovulation, instead of estrogen, the ovary will now make progesterone for 2 weeks. The lining inside the uterus will not grow taller, but progesterone will cause that estrogen-induced growth to become mushy. If fertilization happens and a zygote lands in the uterus, it provides an ideal environment. If there is no pregnancy, the progesterone stops after 2 weeks, just like the estrogen did. And the drop of hormones causes a mushy growth to come out of the uterus, menstruation. The drop of these hormones, like a thermostat would do in your house, restarts the brain signals, and this cycle repeats every 28 days during the reproductive life of a woman. For reasons unclear, about 10 to 15% of women in the reproductive years will develop a problem with their ovary as they begin to climb up the insulin-resistant hill, mild insulin resistance. The brain ovary thermostat gets some wires crossed, and estrogen is made like before, like normal, but so are male hormones, and there is no ovulation, obviously bad for someone trying to conceive. And with no ovulation, there's no progesterone made, so estrogen keeps being made, and the lining of the uterus keeps growing. And the brain signals are like, hey, where are these hormones we ordered up? So the brain sends more signals to the ovary to make hormones. The brain keeps signaling because it is confused, trying to create the right hormone, which is not allowed. This results in even more imbalanced stuff and more male hormones. Bubbles in the ovary keep forming, polycyst, because the brain signal won't stop without the right balance to shut it off. The high estrogen state will keep the lining inside the uterus growing taller until it is so full further growth has no room and leaks out randomly. So this patient seems to always be bleeding. And if a random ovulation does occur, which produces progesterone, after 2 weeks, there will be an unusually lot of mushy stuff built up coming out. Summary: weight gain is the start of PCOS. Weight loss is the cure, and that's easier said than done. PCOS involves 2 major endocrine systems messed up. Each messed up system creates more weight gain, resulting in even more messed up systems. When I discuss medicines treating the disease of obesity, these medicines will be 100% certainly applicable for patients who have PCOS. I strongly suggest, when possible, for anyone with PCOS to use oral contraceptives, which will provide balanced hormone replacement and stop the brain signals causing these abnormal weight gain hormones. There is an older water pill, spironolactone, sort of a good one because unlike many water pills, this one won't lower potassium. And this is often prescribed for some bothersome issues with PCOS. It's off-label. With the abnormal production of male hormones, testosterone, in patients dealing with PCOS, some of this testosterone gets converted to dihydrotestosterone, DHT. DHT is the actual thing that stimulates the skin and hair follicles, resulting in acne and hair growth. It was discovered after this water pill was released for hypertension that it blocked the enzyme that converts T to DHT and can help with these troublesome side effects. Blocked T to DHT means that the bad stuff won't hit the skin and hair. It won't lower testosterone, however, so testosterone's contribution to the unwanted weight gain will persist. But spironolactone taken daily will help with acne and unwanted hair growth. But remember that once a hair follicle has been activated, it will always grow a hair. So spironolactone can help with new growth from developing. Medicines targeting the disease of PCOS will be discussed in another video since they are exactly the same medicines approved for weight loss. Which makes sense. PCOS begins with weight gain and ends with weight loss. Regarding insulin resistance, autopilot, and all the consequences, and I'm not a meteorologist nor know a lot about FEMA, but third-party payers and government agencies, wouldn't it be more cost-effective with the hurricane coming to help with boarding up the windows and putting out the sandbags and overseeing emergency evacuations instead of just saying, oh, let's just let it hit and we will pay for the damages? We can intervene way earlier before damages are extreme. In my love of quotes, Nelson Mandela said, "It always seems impossible until it's done." Thanks for watching Weight Management, A Class with Act.